My name is Taryn Reep, and I am a nursing student in the Nursing 480 Senior Practicum course, and this is my project presentation. I hope that you're able to see it. Did the best I could with trying to capture it on the camera and myself as well so that I can talk about it. So to start, as you can see, I am doing a project on oral health hygiene. I started to do the Project Design 5, and it's one of the health teaching community health design projects, and I was very excited about it. I don't know about everybody else, but at first I was trying to figure out exactly what I wanted to talk about, what I wanted to educate the community on, and I finally decided on how oral hygiene can affect other parts of your body, other comorbidities, other health disparities, since oral health care and medical health care are related. And then it helps with nursing education, continuity of care. So I will get started. I did have a printout of everything up here because this is kind of small, and I didn't know if I would be able to effectively read off the information. So if you kind of see me slide it to the side a little bit to give myself some room, that's what I might end up doing. So I implemented my project at Hickory Dental Care here in, it's in Hickory, North Carolina, about an hour from Asheville. I live in Newton, so it's about 15 minutes away. And they are very nice. They've been so helpful the entire time, answered my questions. They let me spend 8 hours yesterday, Thursday, the 24th, I believe. Today's Friday. So they let me spend 8 hours yesterday in their lobby, conversing with patients and staff. I did wear a mask. I did take some pictures as well. I'm so excited to show you if I can. I'm obviously doing the video first, so if I can figure out how to link them like in a slideshow, I'll link some pictures I took. None of the patients there, just for HIPAA reasons, but I will link them to show you me and some of the staff members and how my day went. It was very exciting, very fun. I was a little nervous, but the staff there really helped me out a lot too. They answered some questions, and it really felt like a team effort, teamwork, and that's what healthcare is all about, especially when we're trying to reach members of our community. We want the best for them. You know, the dental team wants the best for them. The nursing side wants the best for them. We want them to have and achieve the most optimal health they can for quality of life. So to start with, I'll review a couple things from Hickory Dental Care. So they have let's see if I can grab this one. So every 6 months to a year, depending on if your medical history has changed, they actually do a medical history. I don't know if you can see that. And it asks you everything from the physician you see, current medications you're taking, if you've ever had neck injuries, literally a whole history. If you are experiencing any of these symptoms, medications, surgeries, things like that. They do a whole health history, which I think is fabulous because if something changes, they're aware and they're on top of it, and then the patient should be going to their doctor as well, explaining any changes that the dentist recommended based on their current health history. The next thing I found interesting is that every patient that goes to Hickory Dental Care for hygiene, not necessarily if you're coming in for just a treatment, like a cavity, a root canal, a crown, every dental hygiene patient gets a card. It's an oral hygiene report card, and it lets you know if they need to update the medical history, if you had an oral cancer screening need, antibiotic placement, MI paste, which is for sensitivity of the gums, if you need any x-rays. So I think this is really great. The dental hygienist fills this out, but it's awesome because it's letting you, they're not just coming to clean your teeth. They are inspecting you. They're your first eyes and ears, kind of like the nurse. So they're coming doing the assessment, and then whatever they notice, they'll send to the dentist. So you're kind of getting like a second checkup while you're there. So I think that's cool. I actually had this laid out. And then the other paper I had laid out while my poster board was there yesterday was this fun facts about positive oral health habits for seniors. And the reason I kind of chose this picture is because my project was geared towards the middle-aged older population, because what 10-year-old is going to have heart disease from not brushing their teeth? They're going to have cavities for sure. They may need some braces, but they're not going to have heart disease. So I kind of wanted to lend my project and gear it specifically toward, middle-aged older adults and into seniors. This says some positive oral health habits. Brush your teeth twice a day with fluoride toothpaste. Floss at least once a day. Regularly clean and care for dental appliances, if that's dentures, partials. Schedule regular dental visits, as we all should, but they should as well. And then talk to your dentist for the common symptoms listed below: a toothache, temperature sensitivity, bleeding or sore gums, mouth sores, jaw pain or locking jaw, persistent bad breath, dry mouth, and then cracked or broken teeth, which all, I'll kind of go over some of it here. They all can lead to, bacterial infections, periodontitis, which also can turn and lead to diabetes, heart disease, stroke, hypertension, some major cardiac issues, which is one of the main reasons I wanted to educate the community on my project. And then obviously limit some sugary drinks and sticky foods. So I just had this laid out. The last thing that I had laid out was a survey, a questionnaire. I only asked 3 questions. I'll go over those at the very end. And I had 3 questions on the survey card. I don't have them, but it was a very well received project, so I was very excited. I will go ahead and get started. I promise I won't be a whole lot longer, so sorry. So my project is titled Comorbidities Related to Poor Oral Hygiene in the Community. I had a picture here of a normal tooth, and then what periodontitis is, and how it affects certain levels of the base of the tooth, kind of the middle of the tooth where it meets the gums, and causes inflammation, creates areas for bacteria, and leads to other infections. And then this one, this one is a picture of some oral health care facts. It's actually pretty interesting. It said 62% of adults between the ages of 18 and 64 visited the dentist last year. Only 62% of that age group. That's not a lot. Now, I'm not saying everyone needs to go. Yes, I am. Everyone does need to go to the dentist. However, if you're not going to the dentist, are you truly taking care of your teeth? You would be surprised that a lot of people don't understand why we just brush our teeth. They think that we're getting our teeth whiter. They think that we are just getting food out of our teeth, and that we're just kind of getting them clean on the surface, when actually brushing your teeth, you're focused on the gum level, because that prevents bacteria from hoarding in, so that it won't spread to other systemic areas. It also prevents tooth decay, cavities, which is, cavities from forming, and then those can lead to other issues as well. So oral health care is very, very important, and we need to get these people to the dentist. And I would say, since that's between 18 and 64, I would say the majority of people older than that, because they may have travel issues, they may be in a nursing home, do not typically see a dentist. So hopefully this project has helped educate the community members and overall improves their oral health and overall medical health. Alrighty, so I think I'm going to move this. Well, let me show you just real quick, and then I'll read from my paper. I have an introduction part, overall goal, risk for disease right here, which talks about the types of diseases that can occur based on my project that I wanted to inform the community on, not what every disease can occur. Down here, my overall goal, interventions on that side, and then I have references here at the bottom. And that's my poster board. So I'm going to move this over just a little bit. I also had some cards about the size of this that had everything on here except for the references listed very, very smallly, so very, very small, so that way the patients at the Hickory Dental Care office could take it with them, so they could read up on it more and maybe ask their doctor questions, their dentist questions, get them thinking about their overall health care. So I will jump into some of the information from my project. In the introduction, I noted that oral health, it impacts its overall health and it is very important, yet it is regularly overlooked in the aging population, especially in the healthier aging population. They think because they're healthier, they're not at risk, so sometimes we let our oral health slide under the radar. The definition of oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. And let me tell you, this is a great definition. I won't get into a big detail about it, but in one of my journal articles, the definition of oral health was like 4 words. To be free from disease. I believe that's exactly what the definition was. To be free of oral disease. That doesn't encompass anything. This is a wonderful definition. This is actually new. They've been working on this the last few years. So poor oral health affects quality of life across the lifespan. Oral health extends beyond dental disease, with an unhealthy mouth affecting an individual's ability to eat, speak properly. It affects their nutritional status, their body mass index, self-image, and as well increases the risk for developing chronic diseases, which are also called comorbidities or health disparities. According to the World Health Organization, the WHO, oral diseases share common risk factors with 4 leading chronic diseases. The 4 main chronic diseases causing death worldwide are cardiovascular disease, diabetes, cancer, and respiratory disease. Risk for disease. The diseases for which an association with periodontal disease has been reported include cardiovascular disease, stroke, respiratory disease, rheumatoid disease, pancreatic cancer, diabetes type 1 and 2, osteoporosis, and osteoarthritis. And I'll be discussing periodontal disease, cardiovascular disease, and diabetes. Dental caries, also known as tooth decay, is a chronic disease with an infectious component that is prevalent worldwide. Dental caries include the presence of cariogenic bacteria, notably known as Streptococcus mutans and Lactobacilli. These bacteria can lead to serious infections and other health-related complications. Older adults with natural teeth are at a high risk for dental caries, periodontitis, associated systemic infections, and tooth loss. And that's typically because they just don't go to the dentist. Periodontal disease. This is a common oral chronic inflammatory disease often found in older adults. Left untreated, periodontitis results in damage to tissues that support, that support teeth, surrounding connective tissue, and bone. These changes eventually result in tooth loss, gum recession, exposing vulnerable dental roots to both environmental and infectious agents. Diabetes. Evidence suggests that periodontal disease is a risk factor for diabetes mellitus. Preventing and treating periodontal disease may have an impact on both the incidence and the control of diabetes mellitus. Several studies show that improved oral hygiene reduces the hemoglobin A1C levels. It also decreased sugar consumption is also associated with less dental caries. That one we all kind of knew. And then patients with diabetes are also at an increased risk for developing oral infections. Cardiovascular disease. Older adults are at a higher risk for oral infections and associated complications. Chronic oral infections are a recognized risk factor for heart disease, causing manipulation of teeth and supporting structures that increase the spread of bacteria throughout the bloodstream in artificial joints and endocardial implants. An increased number of dental caries, the presence of periodontitis, and a greater loss of teeth were associated with an increased risk of future major cardiovascular events known as MACEs. This includes cardiovascular death, acute MIs, heart failure, and stroke. Age, hypertension, diabetes, tobacco smoking, presence of tooth decay, and periodontitis is significantly associated with the risk of cardiovascular disease. Frequent toothbrushing and regular dental visits were associated with a lower cardiovascular risk and helped lower the risk of cardiovascular events in patients with oral diseases. So it's saying that with better oral health, not only does your risk of developing a cardiovascular disease go down, but if you already have heart issues, your risk of developing a major issue along with your already health disparity, it's reduced. The interventions that I have are ask patients about oral discomfort or tooth pain during regular medical visits, ask patients about dry mouth symptoms, including their regular medical visits as well, recommend the avoidance of both chewing and smoking tobacco, recommend xylitol containing candy or chewing gum to stimulate saliva production for patients complaining of dry mouth, avoid the use of medications that cause reduced saliva production, recommend a dental evaluation for patients with chronic dry mouth symptoms, recommend daily toothbrushing with a fluoride containing toothpaste, recommend daily use of an electric battery operated toothbrush instead of the manual. This is especially for patients with cognitive impairment because it's less work and it covers more surface area in a quicker amount of time. Recommend daily dental flossing. Use floss holders. They may be helpful if you have limited dexterity, patients that might have more contractures and stuff. We want to promote self-care as much as possible. So these options or these items give them an extra option. Recommend the avoidance of foods high in sugar, particular sticky, high sugared foods that have prolonged contact with dentition, which is the enamel, is what I was explained what that is. Consider prescription strength fluoride, such as mouth rinses and fluoride varnishes for patients with a history of recurrent dental caries, and they are high-risk patients, including patients in a nursing home. Patients with existing periodontitis and patients at high risk for periodontitis may benefit from the use of chlorhexidine-containing mouthwash. This also helps rid bacteria. And then provide educational material regarding the importance of oral hygiene and instructions on steps to promote good oral hygiene for patients. And then overall, good oral hygiene, the use of fluoride, regular dental care at least twice per year, the avoidance of high sugar foods, and the appropriate use of antibiotics can all help to reduce oral infections and their associated complications. For patients with significant dental caries, their dentist may suggest fluoride treatments, including fluoride varnishes. And then overall, my goal was to improve oral health literacy and prevention of life-threatening health disparities. Individuals with low health literacy skills often have lesser health knowledge and health status, exhibit unhealthy behaviors, are less likely to use preventative services, and have higher rates of hospitalizations, increased healthcare costs, and ultimately poorer health outcomes. The next level goal was to provide access and utilization to healthcare services, implement increased provider-patient care interaction, and use a teach-back method. The patient is expected to appropriately apply oral disease prevention and treatment recommendations. Following oral health promotion strategies and improved dental hygiene behavior, this could modify the cardiovascular disease risk and other serious risks associated with poor oral health. And then healthcare professionals who provide care for older adults should work to promote good oral hygiene for their patients. So overall, with the research I collected and with the help of the Hickory Dental Care team and our instructor, I was able to successfully create a project that could really benefit our community. It was able to help increase the knowledge surrounding oral health and the related comorbidities that can come along with it, and also the importance of maintaining proper oral health hygiene. And then for the survey, I had 3 questions listed, and they were just yes or no questions. The first question was did this project help improve your knowledge on oral health? Everyone selected yes. I had 15, maybe 16 cards that were answered. The second question was, did the information presented spark any concerns in your current oral or medical health history? And then I had about 8 people select, maybe 7 select that yes, and the other selected no. And then for the third question, do you feel this project will help you implement better decisions regarding your overall health? And everyone selected yes, which was my ultimate goal. Whether they do it or not, I won't ever be able to tell unless I follow up with every patient at Hickory Dental Care, but I won't do that. But I'm going to hope that the information that was presented sparks a little interest each time they're brushing their teeth, each time they're going to the doctor, in hopes that they can maintain good oral health hygiene and prevent any of these listed or any other medical issues from occurring. Thank you guys so much for watching my project presentation. If you have any questions, please list them below. And again, hopefully I'll be able to attach some photos from my implementation day. Thank you so much. Have a great evening.